All right, Dr. Cairo, thank you for joining me today. And so I have a few questions for you. So the first question is, can you tell me a little bit about your practice? What is an oncologist? How long have you been one? And what made you decide to become one?
Sure, Amelia. Thanks for having me today. I am an oncologist. I specialize in cancer, specifically breast cancer.
Mhm.
And I chose to work in the community, which means that I don't work for a big academic organization. I work for a community practice. Now, we're a big community practice. We're 500 physicians across the state of Texas. And so we have reached out into all of the different parts of Texas.
Mm.
I have the privilege of having clinical trials at my site, which means that for appropriate patients, there are opportunities to participate in cutting edge research. I chose to do oncology. I kind of say oncology chose me. I had no intention of doing it. I thought oncology would always be sad. I thought that oncology, wouldn't be necessarily as rewarding as something like surgery. But I was so mistaken. Oncology is it's incredibly rewarding. The long-term um, relationships that I make with my patients are perhaps the most rewarding part of my practice. Oh, and I've been an oncologist for 10 years and a doctor for 16 years.
Wonderful. All right. Now, question number two. I remember when I was reviewing your bio, one of the things that attracted me to you was your experience in India. Can you tell me more about that?
I had some experience in India. I think the experience that you're remembering was in Senegal in West Africa. So in Senegal, the year after college, I did a women's health education project in Senegal. Now, when I say I did it, I really piggybacked on work that was already being done by a very committed organizer and a very committed group of volunteers. So this was a women's health education project. Women's health is a special need, and it goes way beyond breast cancer. In places in the developing world, women's health is tied to also the health of their children. So it's women and children's health combined. And before you can even get to a need like breast cancer, you have to get through a need of like cervical cancer screening. You have to get through the need of safety in childbirth. You have to get through the need of safety in food preparation and in malaria prevention. So there's so much that builds up to the needs in women's health. And we in America are in a relatively privileged position, to think that women's health is going to have a lot to do with, say, women's cancers, and it does. But it really set the foundation for me to be involved in the Women's Health Education Project in Senegal, where Senegalese men and women who were specially trained had classes. And these classes were in purpose-built straw huts. And for a few hours a day, the women would come and engage in, what was sort of a master class in health and safety. And it was a real mark in the community of education and of commitment to improving the health of the whole community to participate in one of these classes. And so it was a really exceptional program, and I can take no credit for, thinking of it or organizing it, but I had the privilege of documenting the amazing, amazing work that was being done.
Wow, that's quite something. Okay, number three. When I was going through chemo, you informed me about a clinical study for acupuncture to prevent neuropathy. So please explain what neuropathy is and whether the project was a success.
Sure. Neuropathy is numbness and tingling in the fingers and toes. And neuropathy, there are nerves, delicate nerves in the tips of the fingers, and they can be affected by a variety of medicines or diseases or disorders. Probably the most common cause of neuropathy in America is actually diabetes. And so chemotherapy is simply one of the causes of neuropathy. And so one of the chemotherapy medicines that I use commonly for breast cancer can cause neuropathy. Now, neuropathy can be temporary and it can sometimes be permanent. And so to have that constant reminder of one's history with chemotherapy in your fingers and toes and everything you want to do every day, man, that's something I'd really like to help my patients avoid. So going back a little bit further, in medical school, my medical school offered a course in complementary and alternative medicine. Now, this course didn't teach me anything about neuropathy and it didn't teach me anything about acupuncture necessarily, but we did actually a lot of meditation, a lot of mindfulness, a lot of biofeedback at that time. But what it did was that it opened up my mind and my heart to all of the possibilities that were out there in the world, and that this could be a part not only of my medical education, but ultimately of my medical practice. So when I saw, years later now, when I saw an article documenting a clinical trial that compared real acupuncture to sham acupuncture in volunteer patients who were receiving the same kind of chemotherapy that my patients were receiving for breast cancer, I immediately wanted to know more. And the results of the article were that patients getting real acupuncture reported less frequent neuropathy and they reported less severe neuropathy. Now, there could be no placebo effect because in the comparison group, the patients were getting sham neuropathy and sham acupuncture. So everybody believed they were getting acupuncture. So there could be no belief or disbelief that necessarily made the difference. So that was really exciting to me. And acupuncture is readily available here in Houston. And so I inform my patients about the study and also inform them, if they're interested, about where they may receive acupuncture if they choose to do it during chemotherapy. And so that's sort of expanding on my role as educator that, really started on that on the back of that motorbike traveling through Senegal.
Very nice. Okay, so what is the hardest part about being an oncologist?
Definitely saying goodbye to my cherished patients. And every single patient is a cherished patient. And so I'd say that's the most difficult part about being an oncologist. There's always a time when you question yourself, and there is that same time when caregivers are questioning themselves, and sometimes that same time when patients are questioning themselves. And so it's an important time to try to ease your heart and ease your spirit so that you can be present as an oncologist for the patients and for their family members to help to ease their hearts and their spirits as they move to the next or final phase of life and then to the beyond.
Yeah. So on a scale of 1 to 10, where 1 is the least and 10 is greatest, how would you rate the value of mental health support for patients as well as their families?
The value is just exceptional. I mean, I would, to put a number on it, I mean, put an 11 on it. It is increasingly being recognized, along with mental health, financial support, social services are all now being increasingly recognized as very important parts of all of the cancer care. It's not always enough to have availability of oncologists, although there are parts of the country and the world that struggle with that. And it's not always enough to have the cutting edge or the best medicines. There are other barriers that may prevent people from accessing those resources or being able to complete or fully participate in the treatment. And so medical practices all over the country are working to engage specialists who can support patients. There have often been support groups, access to mental health professionals who are definitely in short supply, especially in non-urban areas, and even supportive medicines when necessary. It's also incredibly important to support families because families have relied on the patient for support. And patients then rely on their families for support. So keeping the whole network strong is really something that's very critical. So it cannot be overstated.
Yes. So, do you think it is also important for professional caregivers, such as doctors and nurses? What do you do for self-care?
It is, again, also increasingly being recognized. I would say that it was not, that element of self-care was not something that was emphasized during my training. But over the last 10 years since I've been out of training, it has become increasingly recognized, and time and space and explicit encouragement has been made. Over these last months of the pandemic, my emails from my hospital sources and also from my community sources are very much about self-care, about access to mental health professionals for physicians, and also just time out, time to rest and rejuvenate your own spirit so that you can be a better caregiver, when you're back on the wards again. For my own self-care, it's a lot of meditation. It's a lot of yoga. When I don't have time or space for meditation or yoga, breathing exercises. I mean, it's pretty astonishing to me how just, being able to have my hands over my heart and just doing my breathing exercises, I can feel there's that biofeedback, from my medical school days. I can feel my heart rate going down, and I can feel my focus and energy coming back.
Perfect. So, when you had me as your regular patient during the 6 months of chemotherapy, would you agree that I was a model patient? And if so, can you elaborate? And what do you think was the source of my strength?
I mean, Amelia, you faced the tough realities of your cancer with so much grace and so much composure, and did absolutely everything that was asked of you. And you asked all the right questions. You raised all the right concerns. So it was not like you just did it without questioning. I mean, you made sure you understood, what the purpose was and what the expected outcome was and what the potential side effects were. But you moved forward through it with grace and humor. I remember the wigs that you wore to each of your chemotherapy sessions. There was always something different. It was bright and it was sparkly, or it was long and it was dreadlocked, and it was just incredible. So you brought some new facet of yourself to infuse into the infusion suite that day. So you brought all of yourself there, and you were all in, and that, I think, was part of your success. I remember you also talking very much about your spirit and about your connection to the world, and the way that you connected to the world, the way you connected to the office staff, the way that you connected to even the radiation therapy, and the way that you felt that it affected you. And so you were very much in tune, and managing all of that, swirling around you. And so that, I think, was one of the big elements of your success. But maybe you want to speak more on that.
Well, it's a relationship, and communication is absolutely key. And yeah, anyway, I will elaborate further on that outside of this session. But yeah, I will. So
Yeah.
the next question I have for you is one of the things I do to help spread the message of early detection is monthly breast self-exam reminders. Can you demonstrate how to do it?
So the breast self-exam can be done really any way you want to. It can be done lying down. It can be done sitting up. It can be done in the shower. Shower is an easy place to think of to do it because, well, you already have your shirt off anyway. And it's an easy place to think about doing it. So for a self breast exam, um, ah, I will be right back. I know exactly what I need. A breast. So for a self breast exam, you just want to do the same thing each time. So one of the ways would be to examine going in a circular motion, going on the surface and then pushing deeper, and going on the surface and then pushing deeper all the way to the outside of the breast. And you really want to go even beyond where you think the breast tissue is. Other ways to do it is you can go across sideways like this, or some people choose to do a kind of a radial sense feeling or movement. This is the way that I do the breast exam, but they actually did a trial where they had every physician do their own favorite type of breast exam, and then they had all the physicians do each of the types of breast exams. And they found that the physicians were more likely to detect the lump if they did the breast exam pattern that they were familiar with. So whatever you're doing, so long as you're doing it regularly, you're doing it right. So keep it up.
Well, it was my husband who actually found the lump in my breast. So yeah.
So whatever he's doing, keep it up.
Okay, so can men get breast cancer too? And is it different for them to do a breast self-exam?
Men can get breast cancer. It is significantly more rare. For a woman, the risk of getting breast cancer is 1 in 8. And for a man to get breast cancer, I think it's around 1% or perhaps less. So significantly less common. For a man, doing a routine breast exam every month may not be as important as simply having good body awareness. And if a man does detect something that just doesn't seem right, and my men have obviously all detected their own masses, to not be afraid to speak up to your doctor and to seek an exam and an additional workup, because it's treatable and curable.
All right, we're going to skip number 10 because I believe you mentioned that already in the answer to the first question. So the next question is, do you know what are the estimated statistics of need over the next 10 to 20 years for oncologists?
I did not until you asked this question. And so then I went ahead and looked it up. And it turns out that in 2021, ASCO, the American Society of Clinical Oncology, published what they call the ASCO Snapshot. And they were looking at the state of the oncology workforce in America. This was a follow-up to a study that they'd done in 2017 that had estimated an oncologist shortfall predicted between 2007 and 2020. And so when they look, they note that there's around 13,000 oncologists engaged in patient care, and they're in about 1,600 practices. So many practices will have more than one oncologist. That's fewer than I thought, if you want to know the truth. Importantly, about 21% of those oncologists, so a fifth of those oncologists, are nearing retirement age. So they're about ages 64 plus. Now, I always hope that my senior oncology colleagues don't retire too soon, because I really do rely on the depth of their experience and of the breadth of what they have observed in their time. So I'm in no rush for my senior colleagues to retire. I hope to have a long career myself. And interestingly, only about 14% of oncologists are early career oncologists. And so that's age less than 40. So that's a difference there. That's a 7% difference between oncologists who are coming up and oncologists who will most likely be retiring over the next 10 years. So when I did the math on that, that's about a 920 oncologist difference. And so if that pattern were to continue as oncologists were to retire, we'd start to see a crunch. Um, Also interesting is that the distribution of oncology services is not even. In a city like Houston, you're going to stumble across an oncologist practically on every block. There are quite a few of us here, but if you live in a rural area of Texas, you might have a lot more difficulty accessing an oncologist in a shorter, reasonable distance, because only about 11% of oncologists practiced in areas that are classified as rural.
Wow, a lot of information. So my last question for you is, for a young person approximately between the ages of 14 to 21
Mhm.
today, what advice would you give to inspire them to explore the field of oncology?
Well, the first thing I'd want them to be thinking about is simply exploring the field of medicine. Medicine is incredibly rewarding. I mean, my mom had always told me that if it's not difficult, it probably isn't worth doing. And so it is it is a challenging um, specialty and a challenging practice, but it is exciting to do every single day. I remember when I was a resident and I was working at the county hospital here in Houston, I get to the elevators every day, and before I'd push the button, I'd think to myself, I have no idea what's going to happen today. And I'd push the button because I had absolutely no idea. There would be something new and something challenging, and that was really exciting. And also the ability to really connect with other people in a really meaningful, a really personal, and a really fundamental way. That's a really rewarding part about medicine for me in general, and oncology in particular, because I get to be with somebody in that moment that's going to really shake and rock their world, and we get to plot the course to recovery. You know, here you are in the middle of the storm, and I think I know the way out. So it's not going to be easy, but come on, this is the way we're going to go. This is the direction, and I've got a plan. And so that moment where somebody trusts you and where you make that connection, and then you get to keep that connection for the next 15 years. So, you know, it isn't like a surgery or an anesthesia where you have that, you know, important moment of connection and then you never see them again. That was never going to be satisfying for me. I wanted to be able to still know people 5 years later, you know, after their, yeah, that's you, after their diagnosis, and then 10 years, and then 15 years. I like to see their kids grow up, and I like to see them become grandparents or great grandparents, you know, such as the case may be. So it's a really important role, and I would encourage people who want to keep that connection to the world to get involved.
Well, that is really wonderful, Dr. Cairo. Now, I'm going to just thank you very much for today. And I hope that in the future, if I have any other questions, if you could answer them in an email, or perhaps we could do another session like this, because it's just been such a learning experience for me listening to your answers. And I know there will be more questions.
Yes.
So thank you very much, and have a great rest of the day. And you are truly a wonderful doctor. I'm so grateful that you are my doctor.
And Amelia, I am so grateful that we've had these nearly 5 years together.
Yes.
So stay safe, and I'll see you soon.
Yes. Bye. Thank
Bye.
you.